Hello and welcome to the Torrance Memorial Medical Center Pre-Operative Total Joint Replacement class. As you get ready for your surgery, you will likely have a lot of questions, so we created this PowerPoint presentation video to help prepare you for what to expect before, during, and after your surgery. This class includes details about preoperative instructions, information for the day of surgery, and guidance about what to expect after you go home. It's important to review all the information, and we encourage you and your family to take an active role in your care and learn all that you can about your surgery and recovery. Accredited care. Expertise and quality matter most when you're choosing where to receive orthopedic care. Torrance Memorial has the third largest orthopedic program in Los Angeles County and has received numerous recognitions for excellence and quality care. We are the #1 ranked hospital in the South Bay. We have several awards, including the Joint Commission's Gold Seal of Approval for Advanced Total Hip and Knee Replacement Certification. We are a Magnet-recognized hospital. We are an accredited practice transition program and designated as a Blue Distinction Center for hip and knee replacement. Torrance Memorial has been recognized for the 13th straight year as Best Hospital by U.S. News and World Report, and we are a high-performing hospital in orthopedics, knee replacement, and hip replacement. There are 4 phases of care. 1. The preoperative phase. 2. The day of surgery. 3. The hospitalization phase. And 4. The home recovery phase. Pre-operative phase. Choosing your support coach. You will need to choose someone to be your support coach to help you before and after surgery. It could be more than one person, and the coach could be your spouse, a family member, or a friend. Your coach will help you by going with you to the pre-surgery appointments, going with you to the hospital on the day of surgery, encouraging you during the recovery process in the hospital, taking you home after your surgery and helping you with your care, and then going with you to the post-surgery appointments. When you return home from the hospital, your coach will need to help you for the first few days. You may need help fixing meals, getting dressed, and moving around your home. So what is Recovery Coach? Recovery Coach is an interactive online coach that is available before, during, and after your surgery. You can access information to help prepare for your surgery, stay connected with guidance every step of the way. You can also communicate how you're feeling and how you're progressing with your recovery. You also can review educational materials before your surgery, and it'll also help you understand what to expect after surgery and manage your recovery with exercises and self-care. Recovery Coach. You will be automatically enrolled when your surgery is scheduled, and you will receive an email or a text notification with login instructions on how to use Recovery Coach. You could access this on any computer, tablet, or smartphone. You will need an internet connection or email address to log in. And then you could also designate a friend or a family member to monitor your account. Your surgeon will request certain tests and medical clearance from your primary care physician and or specialist. Schedule your preoperative medical evaluation exam 2 to 4 weeks before surgery, but no more than 30 days. At your preoperative medical evaluation exam, your medical doctor will do complete history and physical examination to make sure that you're healthy and approved for surgery. Your medical doctor will also order lab works and an EKG. Your medical doctor will review your medications and any other supplements that you may take. Ask your medical doctor about medications to keep taking before surgery and which medications to stop taking before surgery. If you are taking any blood thinners, such as aspirin or Eliquis, check with your medical doctor and surgeon on when to stop taking this medication before your surgery. In addition to preoperative medical evaluation clearance, you may need to see a cardiologist, pulmonologist, endocrinologist, and you may also need a chest x-ray if those are needed. Pre-registration and pre-testing. You will be receiving phone calls from these 2 departments. For pre-registration, our pre-registration department will verify your demographic information insurance information, and authorization for services if required. And then for pre-testing, a registered nurse will call you from our pre-testing department and will go over and review your medical history, medication list, and go over pre-operative instructions with you. You will also ask me to be confirming this information on the day of your surgery. Preparing for your surgery. Find someone to drive you to and from the hospital. Ask someone to stay with you for at least 24 to 48 hours after your surgery. Have a family member or caregiver stay with you to help you with bathing, meals, and taking medications. Provide us with a list of emergency contacts. Start eating a healthy, balanced diet that are low in salt, saturated fats, and sugar. Increase your fiber intake. Eating foods high in fiber could help with constipation. Avoid alcohol. Stop taking alcohol before surgery and stop smoking or using tobacco before surgery. If you are sick at any time within the 10 days leading up to your surgery, report any of the following to your surgeon. Cold, flu, fever, or chills. Any type of infection, even a tooth abscess. Any non-healing ulcer or skin wound, like insect bites or cat scratches. Cold sore or herpes outbreak, skin rash, or any kind of flare-up. Your surgery may need to be postponed to prevent infection and any post-operative complications. What to bring with you to the hospital. Bring a valid photo ID, driver's license, your health insurance plan card, your prescription insurance plan card with prescription bin plan number in case we need to send information to your pharmacy or our outpatient pharmacy. Bring a complete list of your current medications, including doses, supplements, and over-the-counter medications. Bring your eyeglasses with a case, no contact lenses, your hearing aids, dentures with a storage case, your AICD or pacemaker card, CPAP machine for patients with sleep apnea. Bring your CPAP machine if you're going to be staying overnight with us at the hospital. Clothing and footwear. Bring loose, comfortable fitting clothing that could be easily removed, such as sweatpants or gym shorts. Bring slip-resistant rubber-soled shoes with backs, no open-back shoes or flip-flops or slippers. Bring us a copy of your advance directive or living will. Bring a form of payment for any copays or to fill discharge prescriptions at our outpatient pharmacy. Preoperative phase. Preparing for your surgery. What not to bring. Valuables. Leave expensive jewelry, watches, large amounts of cash at home. Medications from home. Do not bring your own medications unless specified by your doctor. If you do need to bring them in, we will let you know, but they must be in the original prescription bottle. Home equipment. Do not bring any canes, walkers, etc. to the hospital unless you currently require them to walk. We will provide you with a walker. Preparing for your surgery. Shower with antiseptic soap. You will need to shower before your surgery with a special soap called chlorhexidine gluconate, or CHG. Shower the night before your surgery. Shower a second time on the morning of your surgery. You will be given the CHG soap and instructions at your surgeon's office during one of your pre-op appointments. You can also buy the CHG soap at a drugstore without a prescription. If you are allergic to CHG soap, use an alternative antibacterial soap as recommended by your surgeon. So the reason for using CHG soap is to help lower the number of germs on your skin to help prevent infection. Preparing for your surgery. Instructions for showering with CHG soap the night before and morning of your surgery. Number 1. Wash your body, face, and hair with your normal soap and shampoo. Number 2. Completely rinse off the soap. Number 3. Turn the shower water off. Number 4. Pour half the bottle of the CHG soap on a clean wet washcloth. Number 5. Use the washcloth to clean your body from your neck down to your feet. Number 6. Do not put the soap on your face or head. Keep the soap away from your eyes, ears, mouth, and genitalia. Number 7. Gently wash your body for 5 minutes, including the knee or hip where you will be having your surgery. Number 8. Be sure to wash in all skin folds, elbows under your arms, breast, and belly, and wash thoroughly between buttocks and thighs. Number 9. Turn the shower water back on and rinse your body until all the soap is gone. 10. Pat dry with a clean towel. 11. Do not apply any powders, makeup, deodorants, perfumes, or lotions. And finally, number 12. Put on some clean clothes after showering. Pre-surgery bathing instructions. You'll receive a copy of these instructions and a bottle of CHG soap at your surgeon's office during one of your pre-op appointments. Read the instructions carefully and please complete the form, including the date and time that you did your first bath and the date and time that you did your second bath. Bring this form with you to the hospital. Pre-operative phase. The night before your surgery. Shower with antiseptic soap. Do not eat anything after midnight or 8 hours prior to your surgery. You may drink up to 8 ounces of water only, finishing 2 hours before you arrive to surgery. If you need to take medications at home on the morning of your surgery, do not exceed 8 ounces of water. And finally, get a good night's sleep. The day of surgery. The morning of your surgery. Plan to arrive 2 to 3 hours before your surgery. You will need to shower again on the morning of your surgery with the CHG soap. Do not drink any liquids or eat any food, including gum, mints, or candy. Your surgeon or the pre-testing staff will confirm which medications you should take the day of your surgery. If you must take medication, swallow it with only a small sip of water. You may brush your teeth. Wear comfortable clothing that is easily removed. Wear comfortable non-skid rubber-soled shoes. Do not wear jewelry on the day of your surgery. This includes your wedding band. Do not use perfume, deodorants, powders, creams, makeup, or nail polish on the morning of your surgery. Day of surgery. Parking and location. Park in the main parking structure. Check in at the admitting desk located in the Lundquist Tower Grand Lobby. Please check with the hospital or on the TMMC website regarding current visitor policies. You could check our current visitor policies on www.torrancememorial.org. Day of surgery. Registration and waiting area. When you arrive at the hospital, you will check in at the admitting desk and wait in the lobby to be taken to registration. Once you are registered, we will give you an ID wristband that has your name and any other identifying information. Members of the care team will ask you your name and look at your ID wristband many times while you're in the hospital. Checking your ID helps us keep you safe. Following registration, you will be brought to the waiting area on the floor where you will be having surgery. When the operating room staff is ready, a staff person will take you from the waiting area to a pre-op area to prepare you for surgery. Day of surgery. Pre-operative area. A pre-operative registered nurse will confirm your identity, medical history, and planned procedure. You may be asked the same question several times by different healthcare providers. This is to ensure your safety and to ensure the procedure performed is what is planned for you. You will change into a hospital gown. We will give you a hospital gown to change into. You will put your clothes and other belongings into a bag with your name on it. We will give the bag to your coach or back to you after your surgery. A nurse will check your vital signs, your blood pressure, heartbeat, and breathing, and they will also do a short physical exam. You will meet your anesthesiologist and talk about your medications, anesthesia history, and anesthesia options for your surgery. Anesthesia options may include medications for sleep during the operation and medication to numb your leg. You will be able to ask questions about your anesthesia and pain control at that time. A nurse or anesthesiologist will put an intravenous tube, IV, in a vein in your arm or your hand. Your surgeon will meet with you and verify the location and the type of surgery you are having. They will mark the surgery site. You will sign your consent after speaking with your surgeon. Your coach, family member, or friend can stay with you until you are ready to go to the operating room, unless there are restrictions that are in place. Day of surgery. The operating room. In the operating room, you will meet the care team that will be getting the operating room ready and will assist your surgeon, PA or physician assistant, and anesthesiologist during your surgery. You will be in the operating room for at least 2 to 3 hours. When your surgery is over, you will wake up and you will be taken to the recovery room. Day of surgery. Recovery room. In the recovery room, after your surgery, you will wake up from anesthesia. With certain types of anesthesia, your legs may feel numb as you wake up. This is a normal part of an anesthesia and will begin to wear off in the recovery room. With other types of anesthesia, you may have a sore throat, nausea, and pain. Your nurse will give you medications to help. At this time, no visitors are allowed in the recovery room. Your surgeon and or nurse will contact your family or support person with updates. Day of surgery. After surgery. Some patients may go home the same day of surgery, and some may stay overnight. Your surgeon will let you know if you should plan on an overnight stay in the hospital after your surgery. If you are going home the same day, you will likely recover in the outpatient surgery unit. Wherever you recover from your surgery, we will discharge you from the hospital when it is medically safe to do so. Day of surgery. Outpatient procedures. For those of you going home the same day, before you leave the hospital, a nurse will go over all instructions and information you need to know regarding post-operative care. You will be taken by a wheelchair to meet your ride home. Be sure it's a family member or friend, as you cannot use a taxi or rideshare service. And then finally, take pain medication as prescribed to help control your pain. Hospitalization phase. Staying in the hospital. If you need to spend a night or even a few days in the hospital, you will be moved from recovery to a private or semi-private room based on availability and level of care required. Please check with the hospital or TMMC website for current visitor policies. Your nursing team will check on you periodically, monitor your vital signs, and will give you medications prescribed by your care team. Your surgeon will let you know your expected discharge date. Hospitalization phase. The orthopedics care team. The orthopedics care team consists of a lead registered nurse who collaborates and oversees all unit staff and patient care team members to ensure safe patient care. A staff registered nurse, or RN, delivers daily patient care in collaboration with all healthcare team members. A certified nursing assistant, or CNA, assists the nurses with plans of care and activities of daily living, including bathing, toileting, and walking. The orthotech. The orthotech assists with the placement of orthopedic equipment for patients and assists patients with activities of daily living, such as exercises, walking, and toileting. The occupational therapist, or OT. The occupational therapist evaluates and develops a plan for a patient to complete activities of daily living. Occupational therapists will work on hygiene, grooming, dressing, and toileting. The physical therapist, or PT. The physical therapist examines and develops a plan to promote safe mobility. Physical therapists will work on getting you out of bed, walking, going up and down stairs, and getting in and out of the car. The case manager, RN. The case manager supports the physician and healthcare team members in the delivery of care and transition out of the hospital. They also assist in managing the cost of care safely while enhancing the patient experience. The nurse practitioner, or NP. The orthopedic NP sees you throughout your hospital stay and works in collaboration with your surgeon and the interdisciplinary team to ensure a smooth recovery and discharge home. These are the members of your orthopedics care team. Hospitalization phase, staying in the hospital. If you are going to be staying with us at the hospital, there is an admission process. We will monitor your vital signs and do neurological checks, such as checking your circulation, your movement. We'll also check your skin and do a dressing check, skin check. We'll check your IV and medical equipment. We'll do a nursing assessment. We will review your medical history and physical. We'll review your medications. We will orient you to your room and also orient you to the plan of care. Staying in the hospital, patient room information board. In every room, there's an information board that is posted, which includes information about your care team members. It will show you your room number, your today's date, and who your nurse is, who your nurse assistant is, your lead nurse, your doctor, the nurse manager, the telephone numbers for food services and housekeeping. It also has a plan of care, your pain treatment plan, your diet and activity, your planned discharge date, discharge goals, and there's a section at the bottom of the board where you can write in any patient or family questions. Patient safety. Call, don't fall. Falls can be very dangerous. Do not get out of bed without help while you are in the hospital. Please call us when you need to get up or go to the bathroom. A member of the care team will help you. If you do try to get up by yourself, a bed alarm may go off to remind you to stay in bed. Wait for a staff member to help you. While you're in the hospital, please do not ask your coach, family members, or friends to help you get out of bed or walk. They are not trained to prevent falls. So each room has a call out button. We want you to call, don't fall. Hospitalization phase, medical devices. After your surgery, you will be attached to some of these devices. You'll be connected onto a vital signs monitor, which will monitor your heart rate and your blood pressure and your temperature. IV infusion pump. You will have an IV infusion to deliver any intravenous medications. Ice packs. For those of you having knee surgery, you will be wearing an ice pack or ice wrap to help control pain and decrease swelling. Incentive spirometer, which is a medical device to help with your breathing, to do your breathing exercises, to promote breathing and decrease the risk of pneumonia and breathing problems after surgery. Sequential compression device or foot pumps. These devices are connected onto your feet or to your legs to promote circulation and decrease the risk of blood clots. Foley catheter. You may be connected onto a Foley catheter to monitor your urine output. And then surgical drains, which are connected onto your incision site to remove any fluid from your incision site. Hospitalization phase, medications in the hospital. While you're in the hospital, you will be given certain medications. You'll be given pain medications to help control pain. antibiotics to prevent infection, anticoagulants to prevent blood clots, antiemetics to prevent nausea or vomiting, and stool softeners or laxatives to prevent constipation. So these are several of the medications that you will be on while you're here in the hospital. Pain medications. It is normal to feel some pain after surgery, and while you are healing, even when you are taking pain medication, your doctor or surgeon will prescribe medications for mild, moderate, and severe pain. Your nurse will check with you on your pain level and provide you with the right medication. The goal is to control your pain well enough so that you could fully take part in your recovery and get better quickly. So your medications as ordered by your physician in two different ways. Regularly scheduled for overall pain control, as needed when regularly scheduled medications are not effective. You will be monitored closely if you are receiving opioid or narcotic pain medications. The goal is to transition you from IV to oral medication as soon as possible to use the least amount of opioids as possible. So at the top of the screen, you'll see a pain scale. We'll continue to ask your pain level every time we assess you. So on a scale of 0 to 10, what is your pain level? So we will ask you those questions after your surgery. Pain management. Let your nurse know about your pain so they can help you keep it under control. Use ice on your leg or your hip to reduce swelling and pain after surgery. If you are having pain that is getting worse and your pain medication is not helping at all, tell your nurse so that your doctor or surgeon can help. Ask for pain medications before your therapy session so you are comfortable enough to perform all the exercises. Do not stay in bed. Instead, ask to be helped to a chair and to walk around. This will help your body get back to normal more quickly and prevent your muscles from feeling stiff. Stool softeners and laxatives. Pain medications can cause constipation or hard bowel movements. Drink plenty of fluids and take the bowel medication your doctor has prescribed. And then try to eat healthy meals that are high in fiber to prevent constipation. After surgery diet. Most patients will return to a normal diet after surgery. Your diet will advance from clear liquids to regular food as tolerated. Please inform your nurse if you are experiencing any nausea or vomiting. Hospitalization phase. After surgery recovery tips. The more you move, the faster you will get better. So we do encourage you to be out of bed and walking around as much as possible. Try to sit up in a chair to eat all of your meals and spend time with your visitors. Plan to be out of bed at least 3 times a day, walking with assistance and sitting in a chair. Work with a physical therapist to learn how to safely walk with a walker or a cane. Take your pain medications as prescribed. You will have pain, but it should be controlled enough so that you can sleep at night, work with physical therapy, and spend most of your day out of bed and moving around. Take all your medications as prescribed by your medical doctor and surgeon. Drink plenty of liquids to help your body recover from surgery. Eat plenty of healthy foods to help you heal and get strong again. Do your deep breathing exercises as taught by your nurse or respiratory therapist to help with your breathing. And then also do ankle pumps to promote circulation, to decrease swelling, and to prevent blood clots. Hospitalization phase. Patient goals for day 0, the day of your surgery. So we want to make sure your vital signs are stable. We want to make sure you have an adequate urine output. Your pain is controlled. We want to make sure you're tolerating your diet without any nausea. And we want to make sure that you understand the functions of your equipment, such as your walker. Physical therapy and nursing may start to work with you. So these are the goals for day 0. Day 1, post-op day number 1, or the day after your surgery. You will have lab tests. We will monitor your vital signs. You want to make sure that you're tolerating all your meals. We want to make sure your pain is under control. You will have physical therapy and occupational therapy. We will start doing patient education, and then we will also start planning for your discharge. So these are the goals for the day after your surgery. Hospitalization to home recovery phase. Discharge goals. This is a checklist for you to go home. To go home, you must be safe to go home. Your activity goals are met. Your pain is controlled. And you have clearance from the surgeon and the hospitalist. Hospitalization to home recovery phase. Your discharge checklist. Before you're able to go home, this is a checklist of the items that must be done before you go home. You will need to have your discharge instructions and education. We want to make sure you have your medical equipment ordered and available to you before you go home. If you will be having home or outpatient rehab therapy, this should all be set up before you go home. Any prescriptions for medications should be sent to your pharmacy or outpatient pharmacy and be ready for pickup. Transportation arrangements. Make sure you have someone to take you home from the hospital. It can't be an Uber, it can't be a taxi or Lyft. It must be a family member, spouse, friend, neighbor to take you home. And finally, you need to have a follow-up post-op appointment visit with your surgeon, which is usually 1 to 2 weeks after your surgery. So take a look at this list. This is your discharge checklist before you go home. Home recovery phase. When to call your surgeon. It is normal to have some bruising, some tightness, swelling, pain, and redness at your incision site. But if you do have any of the following symptoms on the list below, call your surgeon immediately. If you have a fever above 101.5 degrees, a fever and chills together, a mild fever less than 101.5 degrees that lasts more than 5 days, redness that gets larger and spreads from your surgery site, if the wound oozes fluid and soaks the dressing or bandage, if your incision site smells bad, any part of the incision opens up, if you have severe pain that does not get better when you take pain medications, any changes in feeling or numbness in your toes, or if your toes suddenly look purple or very pale, any sudden changes including increased pain, redness, heat, and swelling in either leg. Call 911 or go to the nearest emergency room if you have any chest pain not relieved by rest or medication, if you have any shortness of breath or you can't take a deep breath, if you feel your symptoms are so severe that you cannot wait to speak to your doctor, call 911 or go to the nearest emergency room. Home and recovery phase. Total joint replacement recovery expectations and goals, weeks 1 to 2. Goals for patients at this point in recovery. Please keep using your assisted device, your walker, until you're cleared by your surgeon or physical therapist. Reduce pain and stiffness. Go up and down a small flight of stairs safely using a handrail. Shower or sponge bathe as directed by your surgeon. Be consistent with home exercise program. Resume simple task at home and then straighten your knee completely if you had had a knee replacement surgery. Please remember, all patients' recovery process is different. Use these goals as a general guide. Please do not feel discouraged if you feel you're not progressing with the goals outlined here. Please talk to your surgeon if you have any concerns. Home and recovery phase. Total joint replacement recovery expectations and goals, weeks 2 to 4. Goals for most patients at this point in recovery. Meet most or all of week 1 to 2 goals. Advance from your assisted device as instructed by the physical therapist or surgeon. improving muscle strength and range of motion, showering and dressing, continue with your home exercise program, begin driving if you are cleared by your surgeon. Straighten your knee completely if you had had a knee replacement surgery. Home and recovery phase. Total joint replacement recovery expectations and goals, weeks 4 to 6. Goals for patients at this point in recovery. Meet most or all of week 1 to 4 goals. Progress from 1-foot stair climbing to regular stair climbing. Normalize gait. Walking short distances without using an assistive device. Drive only if approved by your surgeon. Continue with home exercise program and straighten your knee completely if you had a knee replacement surgery. Home and recovery phase. Total joint replacement recovery expectations and goals, weeks 6 to 12. Goals for patients at this point in recovery. Meet most or all of week 1 to 6 goals. Walk without an assistive device. Go up and down stairs in normal fashion. Walk 1/2 to 1 mile. About 80% of their strength has returned, and resume most or all of their regular activities. Frequently asked questions. How long will I be in surgery? You will be in surgery for at least 2 to 3 hours. How long will I stay in the hospital? Some patients may go home on the same day of surgery or stay overnight. Your surgeon will inform you and you will go home when it's safe. Will I be in pain? Expect to have pain with any surgery. The goal is to control your pain and give you pain medication before your pain level gets high. Your pain should be controlled so that you could sleep at night, work with PT, OT, and be out of bed during the day and moving around. Will my surgeon prescribe any medications after surgery? Your surgeon will give you prescriptions after surgery, including pain medications, blood thinners, and stool softeners. If you will be staying in the hospital, you will be given medications. When can I walk again? Most patients start walking 2 to 3 hours after surgery. Will I need to use a walking aid? You will start off by using a walker in the hospital. You will also go home with a walker for safe mobility. Continue to use the walker until you are re-evaluated by physical therapy and your surgeon. You may start using the cane or walk on your own once you're cleared by physical therapy and your surgeon. When can I drive? Your surgeon will tell you when it's safe to start driving again. Your reaction time may be slower when driving and using the gas pedal or brakes. You should not drive if you're taking any opioid pain medications. When can I travel? You can travel when you're cleared by your surgeon. When you are allowed to travel, inform airport security about your joint replacement. Stand frequently and do ankle pumps during the flight. When can I see a dentist? Avoid having any dental work performed for 3 months after your surgery. If you do have a dental emergency in the first 3 months after your surgery, notify your surgeon and dentist. You will need antibiotics to decrease the risk of infection after surgery. What are the signs and symptoms of a blood clot? A blood clot can occur in either leg. Take anticoagulants as instructed. Signs of a blood clot may include shortness of breath or chest pain that does not go away. Call 911 or go to the nearest emergency room. Sudden changes including severe calf pain, redness, heat, and swelling in either leg. Sudden changes in feeling, numbness, purple or pale color in your toes. Call your surgeon if you are concerned about having a blood clot. When should I follow up with my surgeon? Your first post-operative visit should be 1 to 2 weeks after your surgery. The next section of the class is about important information from the rehabilitation team. Rehab will be tailored to 8 patients, but sessions will vary. The rehabilitation team consists of physical therapy and occupational therapy. Physical therapy begins the day of surgery within 3 to 5 hours after your surgery. So the physical therapist can help you get back your strength and balance so that you can start walking again after surgery. The therapist will give you exercises to do while you are in the hospital and once you go home. Sometimes after surgery, patients work with a physical therapist at an outpatient clinic or in their home, depending on what the surgeon recommends. Occupational therapy begins the day after your surgery. An occupational therapist can help you learn how to safely return to your normal activities of daily living, such as hygiene, grooming, getting dressed, and using the toilet. For those of you having a total hip replacement, there are some important guidelines. For the anterior approach, we want you to avoid extreme hip motions or lunges. And then for the posterior approach, we usually put an abduction wedge pillow, and we do not want any hip flexion greater than 90 degrees combined with hip internal rotation. For the total hip posterior approach, you could do full weight bearing onto your surgical leg. We'll usually put an abduction pillow between your legs in bed. And then when you're sitting, do not lean forward with your knees together at the same time. So these are some important guidelines for those of you having a posterior hip replacement. For those of you having an anterior approach hip replacement, these are some important guidelines. You can do full weight bearing onto your surgical leg, usually 100% is normal. Avoid any extreme hip motions such as those described in these pictures below. And then some important tips: place a pillow under your surgical knee for hip comfort. You can log roll out of bed and sleep on either side. And then just to be careful, place a pillow between the knees for side sleeping. For those patients having a knee replacement, these are some important guidelines. You could put full weight bearing onto your surgical leg, 100% normal. Okay. Walking in the hallway after surgery with a knee immobilizer brace, unless otherwise instructed by the physical therapist. So physical therapists will do a straight leg raise test, meaning if you're able to straighten your leg and raise it up, as pictured, you will not need a knee immobilizer. But if you're not able to do a straight leg raise test, you may need to wear an immobilizer when you're up and walking about. For those of you having knee replacement, never place anything underneath your knee. This will cause your knee to remain in a flexed or bent position, and it will become increasingly difficult to extend or straighten your knee. So do not ever put any pillows underneath your knee. You can put it below your knee, like under your ankles or your lower leg, but do not put anything underneath your knee. Okay, these are the therapy goals for day 0 or the day of surgery. So we want you to get out of bed, same side as home. They want you standing with a walker. We want to be able to do some weight shifting, marching in place. And then the next step is going to be walking with a front wheel walker in the hallway. The physical therapist will work with getting you normalizing a walking pattern, like your posture, equal stride length, cadence, and weight shifting. And then sitting in a bedside chair for at least an hour, up for meals, like when you're eating dinner, lunch, breakfast. You want to make sure you're sitting up in a bedside chair. And then the physical therapy or rehab team will also review an exercise program with you to go over exercises that you could do while in the hospital and at home. So these are, for those of you having a knee replacement, these are the post-operative knee exercises. You will be given this handout. You could also learn and practice this prior to surgery. We want you to be able to do some straight leg raising, sitting knee flexion, sitting knee extension or stretches, ankle pumps, and quad sets. So you will be giving this information before and after your surgery. For those of you having a post-operative hip replacement, you will be doing these hip exercises: ankle pumps, quad sets, a glute set by supine like while you're laying down, and heel slides while you're laying down. So the physical therapist will teach you how to do these exercises after your surgery. The therapy goals for the day after surgery: the physical therapist or rehab team will work on stair training. They'll be working on some advanced exercises that you could do. They'll also discuss car transfers, like getting in and out of your automobile or vehicle. And then occupational therapy will teach you safety and activities of daily living, such as hygiene and grooming, lower body dressing, putting on shoes and clothes and pants, getting up to use a toilet, and then home safety education. So these are the goals for the day after your surgery. During physical therapy, you may have some possible symptoms, but they will monitor you. You may have some dizziness or lightheadedness, so they will check your blood pressure before you get up to check if you have any dizziness or lightheadedness. If you have any nausea or any vomiting, your nurse will administer any anti-nausea medications that you could take maybe before your physical therapy session to prevent any nausea or any vomiting. And if you're having pain, like from the pain scale on a scale of 0 to 10, well, that's your pain level. We will control your pain with medications, such as putting ice and elevating and doing range of motion exercises. So these are the possible symptoms that could happen during your physical therapy session. Preparing your home environment. So at home, you will need to prepare your environment, like removing your throw rugs or having non-skid rugs. Make sure that cords, obstacles, and small pets are out of the way. Make sure your interior is well lit, like putting night lights, or to make sure that your walk space is clear, that you could accommodate your walker. If the spaces are too narrow, physical therapists will teach you a sidestepping technique. Make sure frequently used items are at waist height so that you'll be able to reach those items easily. Consider grab bars in the bathroom and a shower chair or tub bench while you're bathing for safety. And then consider simple meal prep in advance, like preparing your meals before your surgery and having those meals available to you after your surgery. Possible equipment for home. Front wheel walker. This is the first phase of rehab. So during a hospital stay, physical therapy will evaluate you on using a walker. And then the second phase of rehab will be transitioning to a single point cane. And then at home, you may need special equipment like a bedside commode or elevated toilet seat. Those are all optional, but if you do need those, physical therapists will recommend what to use after your surgery. So these are the therapy options after leaving the hospital. Most patients go home with outpatient physical therapy. This is the most common. Number 2, home with home physical therapy, and then transitioning to outpatient physical therapy in 1 or 2 weeks. And then 3, transfer to a skilled nursing facility for rehab, followed by home physical therapy, then transitioning to outpatient physical therapy. So these are the therapy options after leaving the hospital. Okay, that completes our part of the class. If you have any questions or any concerns before or after your surgery, please contact us or your surgeon's office. The Torrance Memorial Medical Center Lundquist Orthopedic Institute is open from Monday through Friday from 7:30 a.m. to 3 o'clock p.m. There's a telephone number listed at the bottom of the screen. Our number is 310-784-6332. And then you could also send us an email at jointreplacement@tmmc.com if you have any questions or any concerns. Okay? On behalf of the Torrance Memorial Lundquist Orthopedic Institute, we would like to extend our gratitude to you for trusting us with your care. Our goal at Torrance Memorial is to provide you with the information and guidance to make this a positive experience. We hope that the information provided in this presentation has helped give you an exceptional experience in learning about your surgery. Again, thank you, good luck with your surgery, and goodbye for now.